Hi guys, today I'm going to talk to you about arthritis and the dreaded diagnosis of that condition. So a lot of people dread the diagnosis and it comes as a big shock when they get it from their GP as a result of an X-ray or MRI that they have arthritis. But the main thing that we need to keep in the back of our mind is as we age, the joints take wear and tear. That's the term, the common term, and people are comfortable with wear and tear, but then when wear and tear comes in the form of a report as arthritis, people get quite shocked and upset sometimes. So today I'm going to try and talk through some of the, give you some reassurance about how to overcome this negative impact, and it's a psychological, emotional impact that it has, and what you need to do to keep ticking away, because the body is a well-oiled machine. You need to keep working it in a way that it's manageable, that a way that it likes. Is that okay? And that implies that we keep the muscles working around the joint so that the joint is supported in between. So in the instance, let's take the example straight away of what is arthritis is. So if we draw, excuse my artwork now in advance, but if we drew a knee joint like this, so this is the femur here, okay, and that has a layer of cartilage on it, like the blue line here, okay, and then we have the tibia, which is the shin bone down here. You might be struggling to see it. Tibia is here, okay, and you have the blue line of cartilage running along here and a blue line of cartilage here, which is the meniscus, okay, and what happens in arthritic change is that these tissues, this cartilage between the surfaces of the bone wears a little bit. Is that okay? So that happens as if you picked up an injury or had surgery, that would be magnified. The rate of arthritic change would be amplified. But as we age, this arthritic change happens, okay? The surfaces of the joint wear because of repeated strains and loads, and that's okay. That's part of the normal process. And as long as you are consistently exercising and moving in a sensible way that the joints and body can manage, then the rate of this change is less severe and the pain associated with that is less severe, okay? Like an arthritic pain or arthritic change does not equate to pain directly. So people can have significant arthritic change on an MRI or an X-ray and have little or no pain. Is that okay? And the question is, why is this possible? How is this possible? Why does this occur? It's because that the activities that they're doing on a daily basis, their body is used to doing them and they're not overloading those arthritic joints. Quite possibly the muscles around the arthritic joints are doing a good job to offload the joint so the joint doesn't take up the pressure. On the contrary, if you have someone who has a very weak outside hip muscle here, and every time they take a stand, they drop down into movement like this, every second step, and they're doing this action, dropping down into it, that would potentially compact or overload the joint, because every second step, that joint is absolutely getting clobbered, and that could cause an overload. And as a result, over time, and we're talking years here, that joint starts to degenerate or build up more bone tissue in response to the stress, which is the body's way of dealing with that overload because of this lack of muscle control. And that happens over years and decades, okay? So it just takes a long time for the body to present with pain. So the main thing that you need to take about here is to be proactive. If you pick up an injury and you start walking in a funny way, or you start moving your shoulder in a funny way, or whatever, then you must be mindful that you're correcting that compensation, okay? So that there isn't a compensation that's unfavorable. And once we are correcting an injury or an unfavorable compensation, ensuring that the muscles around the hip or the knee or whatever body part is working properly, so those muscles are working properly, then that joint is supported. Then those surfaces here, despite being degenerated, having arthritic change in them, they're still going to be able to take the pressures of putting the weight through the knee joint or putting the weight through the hip joint, okay? So it's about having that happy medium of doing the right amount of exercise, the correct type of exercises to keep you moving, to manage the pain. And in a severe case, if we have someone who comes in with severe arthritic pain in the hip and they are responding to some physio treatments, and there's quite a number of different types of treatments that we do to alleviate pain as we restore the muscle function around the hip. That process takes time, but you should, and we expect that you do feel steady, positive change. So your pain goes down, the pain goes down, and your mobility and your independence and your mobility goes up. Is that all right? So pain goes down and mobility goes up. That's what we have to see. That's what you have to feel. There's no two ways about that. Okay, so there are lots of things that you can do to improve and work with when you have arthritis. The diagnosis of arthritis may come as a shock. Don't get alarmed by it. Empower yourself with good information to be proactive. You can still exercise even with an arthritic hip or knee. You can go to the pool, you can do walking up and down the pool, you can hop on an exercise bike. You can still do your other activities, but you just need to take it easy on those a little bit, take them a bit more gently and box clever, as it were, as that hip pain or knee pain or whatever area it is settles down, okay? And let's not forget, you can get arthritic change anywhere. Okay, and the analogy that we use, or that I like to use, is that a joint, an arthritic joint, is like a rusty hinge. And if you allow a rusty hinge to stay put, it will seize. And the same thing for an arthritic joint. If you stop using and stop working on an arthritic joint, it could and will seize up and stiffen. So keeping a nice little bit and sensible amount of movement, working through the wrist, elbow, whatever the joint is, will keep you in your best shape possible. Is that okay? And so we hope you found this video informative, and as ever, we like to empower you to move well, feel well, and be well by being proactive and taking the right lifestyle choices to keep that lifestyle that you want and keep mobile. Have a great day.